When my son was 18 months old, his doctor recommended he get tubes in his ears. He had recurrent ear infections that might affect language development. As a physician myself, I dug into the medical research, and it seemed that tubes might help, but all kids catch up anyway. In the end, I made my decision as a parent, not as a doctor. I wanted my kid to have the best opportunities, and besides, it was a low-risk procedure. Everything will be okay, I was told. 2 weeks later, I scooped up a sleeping toddler before dawn and hailed a taxi on the darkened city streets. In the hospital, the OR was uncannily cheerful. The nurses sang songs, the surgeon had elephants on his hat. I wiggled a hose of anesthetic in front of my now squirming son, which did nothing for 10 long minutes. Just when I thought this technique would never succeed, my son slackened ever so slightly, and at that moment, the OR clicked into action. The cheery demeanor dissolved, and the patient was whisked from my arms. In less than 3 seconds, he was strapped on the table with a mask over his face, utterly still, and I mean unhumanly still. At that moment, my faith in science plummeted. My decades of medical training, my PhD in biochemistry, my grounding in the scientific method, it all evaporated. The sight of my son's body, deathly rigid on the OR table, completely unhinged my confidence that everything will be okay. I was not sure that anything would be okay. My little baby, 23 pounds, including race car pajamas, seemed minuscule under 5 lumbering adults and gargantuan steel equipment. And there was nothing I could do to help him. An orderly led me out of the OR, and I suddenly clenched onto his arm. Please, I beseeched him, please make sure my son is okay. It'll all be fine, he reassured me, even though he had no role at all in the surgery. But he was wearing scrubs, so he was somehow part of this medical complex that had swallowed up my little son. I paced the waiting room, the knot in my gut twisting. Adverse outcomes were rare, I knew that. But I also knew from my medical experience that when a procedure is performed frequently enough, those rare occurrences, they occur. And so, when the surgeon reappeared without my son in tow, my heart stuttered to a standstill. I steeled myself. It's all done, he said, kicking back a slug of coffee. It took some time for the reality of his words to sink in. Even when a sleepy, tousled boy was placed in my arms, the panicky choke of fear still gripped me. I've always been a rational person, confident in the power of facts. Knowledge armed me against the existential fears of the universe. And yet, faced with a minor surgical procedure, my armor crumpled like dust. Parents make a frightening bargain of uncertainty when they entrust their children to the medical system. It's like those classic psychology experiments with the plexiglass bridge over the sheer drop. The medical system beckons. It's safe. We'll guide your child across the glass bridge, but your eyes and your emotions, they see only the abyss. And it dawned on me that I ask my own patients every single day to step over this void, reinforced only by my beckoning assurances. My son recovered rapidly. He was into trouble before lunchtime, but my emotional vulnerability lasted far longer. I'm still an empiricist, but I now appreciate how quickly this rational protection can dissolve. And so, when I sit with my patients now, I still lay out the risks and benefits in a logical manner. But I also try to acknowledge the raw fear that data cannot assuage. We can't eliminate this necessary leap of faith that medical care ultimately requires. But we can at least recognize the stomach-plummeting sensation that occurs whenever a patient edges their toes over that invisible glass bridge. Thank you.